Guys, in this video, we shall discuss about organochlorines. Dichloro, diphenyl, trichloroethane, that is DDT, is a prototype insecticide of these chlorinated hydrocarbons. The other compounds are chlordane, heptachlor, dialdrin, and aldrin, are compounds used for termite and roach control. Most have been restricted or banned in Western countries like US, Europe, and many other countries because of the persistence in the environment and a long half-life in the human body. There is a term called biomagnification, which means the persistence and the accumulation of the compounds of organochlorines in the hierarchy of the food chain. So, for example, when a cow or a goat eats or a deer eats the compound contaminated food, then the compound will be transmitted and will be present in the meat and which will be accumulated in the human body too later on after the food consumption. So because of this toxicity, these compounds have been banned, but although these compounds are very cheap to prepare, so because of this many third world countries are using these compounds. So hexachlorocyclohexane, that is lindane, is a general garden organochlorine insecticide that is also used in some countries to treat scabies and head lice infestations. But in case of children and elderly, they can develop the neurotoxin and seizures with therapeutic use of lindane. So it is contraindicated in these age groups. Coming to the pathophysiology, organochlorines are essential neurologic stimulants and can be toxic after dermal inhalation and GI exposures. Transdermal absorption is affected by the vehicle type of the vehicle and agents, either liquid or solid physical state. So organochlorines, they antagonize GABA mediated inhibition of central neurons, leading to hyperexcitability with repetitive neuronal discharges following the action potential. Organochlorines are highly lipid soluble and accumulate in the human tissues. Most are capable of inducing hepatic microsomal enzyme systems. So because of which the other efficacy of the drugs will be reduced because they will be inactivated. So coming to the clinical features, neurologic symptoms predominate in acute organochlorine intoxication because it is mainly affecting the GABA neurons in the central nervous system. So mild poisoning leads to dizziness, ataxia, fatigue, malaise, headache, neurological stimulation with hyperexcitability, irritability, and delirium. Apprehension can be seen, tremulousness, myoclonus, and facial paresthesias can be seen. So more severe manifestations may result in seizures, hypothermia, coma, renal injury, and death. Seizures may occur early without prodromal symptoms and usually are short-lived, although status epilepticus may be seen. And organochlorines are marketed dissolved in hydrocarbon solvents, and that by themselves can cause sedation, coma, and aspiration pneumonitis, along with the organochlorines. Okay. So either the organochlorines or the solvents can sensitize the myocardium to endogenous catecholamines, which will lead to cardiac dysrhythmias. Chlorphenapyr is a prodrug insecticide that is converted to active form after absorption by the insect. Chlorphenapyr manifests biphasic neurotoxicity. Initial symptoms are non-specific. Also, they include headache, body aches, drowsiness, and weakness. A latent period of apparent recovery is followed on the seventh day after ingestion by rapidly progressive paralysis leading to coma with fatal outcome. No treatment is effective once delayed symptoms start. So diagnosis is mainly based on like history is important and valuable information can be obtained from the package label regarding the project, regarding the product and vehicle involved. And laboratory investigations are not that much of helpful in case of organochlorine toxicity. And their levels can be detected in serum and urine by special lab investigations. So they're coming to the treatment part. Decontamination with the removal of clothes and washing the skin with mild detergent and water will be helpful. And treatment includes administration of oxygen with intubation indicated to treat hypoxia secondary to seizure, aspiration, and respiratory failure. Benzodiazepines are indicated in case of seizure control. And in case of dysrhythmias, epinephrine should be avoided because organochlorine uh, can be associated with many dysrhythmias because they sensitize myocardium to endogenous catecholamines. Hypothermia is managed by external cooling, and activated charcoal and possibly gastric lavage may be helpful. The extreme resin cholestyramine is potentially useful for symptomatic patients exposed to chloroticone. So disposition patient should be observed for some time in the ED, and if the symptoms persist, they should be admitted. Okay, thank you very much.